What if you could transform your practice by diagnosing and treating even the toughest conditions quickly and effectively? That's the power of auricular medicine, a tool that's rewriting the rules for acupuncture and patient care. In this training, I'll show you how to rapidly pinpoint and treat acupuncture channel deficiencies via the ear. I'm Dr. Jeremy, and my goal is to help acupuncturists like you deliver extraordinary results with cutting-edge techniques. If you haven't already, make sure to subscribe so you never miss out on the latest in advanced acupuncture training. And don't forget to grab your free guide loaded with everything you need to implement these methods today. Let's get started.
So now we're back to here, right? So now that this patient comes in, tooth number 11 had mercury, and now you found the right liver ear area, you stuck a needle, you found non-dominant histamine area, you stuck a needle. There's 2 needles. You still allowed 2 more needles in this system. Now, it's not a hard and fast rule. That's what I follow, 4 needles. But if you want to do more, go for it. What to do next? How to fill the liver gallbladder channel and fill the tooth and get rid of itchy leaks such as stuck emotions stuck in this tooth or stuck fields in this tooth or scars in this tooth. Well, simply come to tooth 11 here on the ear. Again, use your point to select. Okay. Use your point to select. Find the most deficient in this tooth number 11 point. Take your time, mark the point, and stick the needle in the center of the point and apply electricity. That's option 1. This is the left ear because this tooth is on the left side of the body. That 1 needle will fill up both sides of the body, all the liver and gallbladder channels. Okay. It will also get rid of leaks. Now, this tooth number 11 is the same as this tiny green speck here on this holographic jaw. So you can treat the liver gallbladder tooth on the upper left, on this upper left tiny holographic jaw that is in the center of my magnifying glass. It's the same point. It'll measure the same amount of deficiency. It will get the same result. Okay. And that's my favorite. I prefer this tiny holographic jaw. But maybe I already have a point here. Like, let's say I have this point here and I want to treat tooth 11. Then I might go here. Why? Because you're trying to separate your clips as far apart in space as you can. And this not a lot of distance between this point number 14 and this tiny green speck here. There's more distance up here. Okay, I'm just giving you examples. Now, let's say you don't like the ear, you despise the ear, but you still want to treat this tooth number 11. This is the body point. Gallbladder 30 is the body point related to tooth number 11. Now, if you needle gallbladder 30 on the body, that will get rid of leaks in this tooth. However, it will not fill up both sides of the liver gallbladder channel. And I'm talking generalities. Does that make sense? Now, gallbladder 30, let's say you're a body acupuncturist, you want to treat tooth number 11, so you're like, okay, I consulted the chart, I'm going to treat gallbladder 30 on the body. Which side, left or right? I'm in the chat section, let me know. What do y'all think? Somebody says right. Diane says right. Why right? Yes, Tamara says same side. This tooth is on the left side, isn't it? This is the upper left tooth, number 11. So you want to treat gallbladder 30 on the left, just as you would treat gallbladder 30 or tooth number 11 on the left ear. So it's left. If it's tooth number 6, then you could treat gallbladder 30 on the right. Okay. So in this example, now we have 3 points. We have right liver ear area. For mercury, we have non-dominant histamine. And it's not only mercury. Don't root canals produce pathogens and toxins that overwhelm the immune system? So you're back to right liver ear area, non-dominant histamine point area, cavitations, any dental issue basically is going to be an immune toxin issue. Right liver ear area, non-dominant histamine. There's 0.1, 0.2, and now we have 0.3, tooth number 11 in. There's still one more point, right? What do you want to do? Well, a lot of times you may have already done 4 points if you did the autonomic nervous system treatment, but let's say you didn't have to do the autonomic nervous system treatment, so you still have one space left for another point. Why don't you choose another tooth issue? Do they have a wisdom tooth extraction? Now, wisdom tooth extraction is amazing for diagnosis and treatment purposes. Why is that? It's because the 4 channels, all these teeth, 2 channels are flowing through, but the wisdom tooth has 4 channels. So 4 teeth, 4 channels, and they're pretty important channels, aren't they? Yeah, well, heart disease is #1 killer. Heart channel runs through there. Autoimmune disease, small intestine and small intestine organs where a lot of stem cells are, run through there. And the autonomic nervous system runs through the wisdom teeth. Triple energizer sympathetic, pericardium's parasympathetic. And we want to get our patient into strong, long-lasting parasympathetic so that they can heal and regenerate the terrain, and the immune system cleans up the terrain and stem cells can come back on board and start regenerating tissues. So I'm asking in this little example here, patient with MS or ALS or tremors or any crazy disease comes in and you look and you got mercury in tooth 11. We treated right liver ear area, non-dominant histamine, and we treated tooth number 11, either on the tiny jaw or here. Now, what do I do? Well, I see, hey, do you have any wisdom tooth extractions? Or you can just look in the mouth and see, oh, yes, there's a wisdom tooth extraction. Okay, you'll see from the masterclass, 90% of wisdom tooth extractions fail, turn to cavitation, silent infections, where 99% of the dentists disagree with what I just said, and most of the Western medical world disagrees with what I just said. You don't see me on public TV broadcasting this info. Why? Because we have to stay hidden until there's enough of us that they can't do anything about it. So, okay, yeah, I have tooth number 16, or let's mix it up and go to the lower. I have tooth number 17 is extracted. Bam, they got fire channel deficiency. That just adds to our diagnosis, right? Might change with RFK, says John. I hope so. Let's see. Oh yeah, we're here. We go back to our diagnosis. Which acupuncture channel? Well, if they have a wisdom tooth extracted, that is a fire channel deficiency. So what do I do? Well, this is a lower jaw, and it's on the left side of the body. I can come to this little red speck here on the lower jaw on the left side of the body. I could come, here's the tooth number 17 point, but the fact that it's hollow means it's on the underside, and that's too much work for me. So I'm going to come to this point here. Now, I gave you 2 ways of treating this. One is find the point, mark it, stick a needle, and put electricity. The other way is find the point, put electricity for 15 seconds by holding the T button, make a little mark, and put a gold seed. That's totally legitimate, and you can get great results also. And a little more advanced method is intradermal needle in the ear. And I like that. That's the strongest treatment. And that's because it's a trickle charge of -20.8 millivolts or greater for up to 3 weeks that needle can stay in.
All right, what did you think? I'd love to hear your thoughts or answer any questions, so feel free to drop a comment below. And remember, I've put together a free downloadable guide with everything we covered today. Just check the link in the description, grab your copy, and start using this powerful information in your practice. If you enjoyed this episode, give it a thumbs up, and feel free to share it with colleagues who'd find it useful. And, as always, for more in-depth training and resources, head over to electroacupunctureinstitute.com. Thanks for tuning in, and I'll catch you in the next one.